Hey everybody, welcome into this Caregiver Journey Conversation by Carallel for the month of March 2023. I'm Matt Perrin, Director of Caregiver Engagement here at Carallel. And if you've been to one of these sessions before, you know these are quick 30-minute fireside chat, virtual fireside chat style conversations where we talk about just caregiving topics. And really excited about today's conversation, which is a lack of health equity for caregivers and what we can do about it. Now, as excited as I am about the topic we're going to be talking about today, really feel fortunate to have an amazing guest joining us for the conversation. She is a physician, the founder of Your GPS Doc, a healthcare navigation and advocacy company, a former family caregiver, a health equity consultant, former TedX speaker. I mean, have I missed anything, Dr. Rochester?
No, I think you got it all, Matt.
All right. Well, welcome to Dr. Nicole Rochester, and thank you so much for joining us. How's everything going for you today down in Maryland?
Everything's going well. Thank you for having me. I'm really looking forward to the conversation.
Well, excellent, and it's our pleasure. We're honored to have you. I just have a couple of quick housekeeping items that I'll get out of the way, and then we'll jump right in. So if you are joining one of these sessions for the first time, if this is the first time you've heard the name Carallel, first off, welcome. Thanks for being here. Just a quick tidbit about our company. We're a caregiver support company. We support family caregivers in two primary ways. First and foremost, with our caregiver support line, which is staffed Monday through Friday by our team of care advocates, and they're helping family caregivers with whatever challenges they have on their plate on a given day, week, month, etc. Could be just lending a compassionate ear. It could be guiding somebody through advanced care planning, moderating family meetings, helping find available in-home care or senior housing, or anything else that's on a caregiver's plate. And we complement that support with My Care Desk by Carallel, our digital platform that's chock full of proprietary content, written content, video content like this session we're having today, practical tools and tips to manage tasks and keep family and friends up to date, etc. So human support complemented by our digital platform, and we make our service available through health insurance plans and employers across the country. Now, secondly, the much more important piece of housekeeping is these are conversations by design. There's no presentation, no slides, so we'd love you to be a part of it. If you have comments, questions, perspectives to share, please do drop them in the chat of the GoToWebinar console. I'll do my best to keep an eye on that throughout the conversation, and we'll address everything we can live in the session. Anything we don't, be certain to follow up after the session. Whew, that's it. I think I got everything. Did I miss anything, Dr. Rochester?
Sounds good to me.
Well, let's get into it. And we really, Dr. Rochester, try and stay focused on the practical in these conversations. So, you know, that's first and foremost for us when we enter any of these sessions, no matter what we're talking about. So today, that means really trying to just discuss the reality of this lack of health equity for caregivers, for millions of caregivers across the country, looks and feels like, number one. And number two, to talk about practical ways practical things we can apply, caregivers can apply in their day-to-day to sort of make navigating some of these inequities and make their caregiving a little bit easier. So that's our goal for the session. I'd love to just start off by getting your high-level perspective initially on what that lack of health equity for family caregivers, millions of family caregivers across the U.S. looks like.
Sure.
Any opening thoughts?
Yeah, I always like to start these discussions by just like definitions and just making sure that we're all on the same page, because I have found that even in the medical and healthcare community, people often confuse equity with equality. So the working definition that I tend to use in terms of health equity is making sure that everyone has what they need in order to achieve their best health or their optimal health. And it's important that we define that, because particularly in our country, Matt, there's this idea around equality and this false perception that everybody gets the same thing and everybody has the same level playing field. And that's certainly not true. And so when we have conversations about health equity, we really have to ground them in an underlying belief and understanding that there are some populations in our country, whether it be race and ethnicity, whether it be based on their socioeconomic status, where they live, many other identities that in fact make you less likely to be able to achieve good health outcomes. So with that in mind, when we think about family caregivers, and I reflect on my own personal experiences caring for my late father with my older sisters, and the experiences of many others who have an identity that makes you marginalized, whether again it's your race, ethnicity, your sexual orientation, gender identity, your socioeconomic status. Caregiving is hard for everyone, like literally everyone. I'm sure that your clients, your audience knows that. And so if you can imagine that, as difficult as caregiving is across the board, when you are part of a group that historically has been excluded, and that is subject to bias, discrimination, racism, those barriers that every family caregiver faces become even greater, and in some cases, insurmountable. So I guess I'll just kind of start with there. I know we're going to go a little bit deeper, but I just like to kind of paint that picture, because often people will say, well, I'm not this, I'm not Black, I'm not Latino, I'm not gay, and I care for my mother, and it's hard. And yes, like it's hard for everyone, but it's even more difficult when you're facing all of these additional barriers.
Yeah, I appreciate you starting off with that perspective, and something I know our care advocates are constantly doing with whoever they're helping is providing the support through the lens of a person's life context, right? Because the other thing about caregiving, to your point, it is difficult, for everyone. The stuff that's talked about is sort of the base level of what you were, one of the first things you said, which is caregiving is hard across the board. Sure, it's emotionally stressful, it's financially stressful, it's physically stressful, it can be rewarding too. All of that, sure. But the reality of the situation you were alluding to, which is then there's the life context, which is an amplifier. The way I'm hearing what you're saying, or can be an amplifier. So particularly if you start to look across, gaps of social determinants of health, for instance, and economic stability, whether it be employment, income, medical bills, debt support, the physical environment, housing, safety, broadband access, Wi-Fi access, all of these sorts of things, right on down the line through education, literacy, language, digital literacy, these things that just millions of people face every day, just amplify the challenge faced by a huge portion of the caregiving population in this country. So what are, does that make sense? Am I capturing that right? Am I feeling, is that point of view sort of in line with your thinking?
Absolutely. Yeah, like you just listed, those social drivers or social determinants of health. And the reality is that, like you said, depending on your life context, which unfortunately in our country is largely tied to your identity, how those drivers show up are going to be different. And so we know, just as one example, if you're looking at employment, people from marginalized communities are more likely to be employed in lower wage jobs. They're less likely to have access to like family medical leave, leave in general. And so if you're working an hourly job, just as one example, where you only get paid if you show up to work, and you also happen to be a family caregiver, you can imagine the challenges that that particular household faces, not only when it comes to the financial strains of caring for a loved one, but even the ability to take off of work with ease to take your family member to a medical appointment, or to be able to be at their bedside when they're hospitalized, or if they're in a, an acute or subacute care facility. So it shows up in so many ways.
Yeah. I appreciate that perspective, Dr. Rochester. And so we have just keeping an eye while we're talking here on the comment. We have a comment from an audience member, which is health literacy is a barrier as well.
Definitely.
Yeah, and that's, I guess, to some degree dovetails into one thing I wanted to ask you about next, or get your perspective on. As we think about, I was mentioning a few social determinants of health a couple of minutes ago. One that I didn't get to is the healthcare system, which is something specific I wanted to ask you about, just because, in general, it's a system that's historically focused on the patient, not the caregiver. And then you get into all of the stuff you've been sharing, the points you've been making here in the conversation. And so, then there things like provider bias and access come into play, which, again, this conversation in the caregiving context, it just all makes everything just that much more difficult. I mean, how does that, I mean, what are your thoughts on just the healthcare system piece of this equation?
Yeah, I consider myself both an insider and an outsider to healthcare. As you mentioned, I am a physician. I'm a pediatrician by training. And I'm also, as you mentioned, a former caregiver. And it honestly wasn't until I became a caregiver that I really started to deeply appreciate and understand how complex the healthcare system is when you're managing it and navigating it as a daughter, in my case. And it's unnecessarily and ridiculously complicated. And it just creates a lot of additional barriers that really impact family caregivers. And so, you're right. Well, you said it's centered around the patient. I'm going to say, I mean, I wish that our healthcare system was focused on the patient, but honestly, there's some other priorities that rise above the level of the patient. But certainly, as difficult as it is for patients, family caregivers, and I found myself in this position, we often are somewhat invisible in the healthcare system. And while we are doing a lion's share of the work of the health, I mean, literally the healthcare system would crumble without family caregivers, like completely crumble. So while we are responsible for the day-to-day care, and often things that in previous years would have been done in hospital settings, in doctors' offices, a lot of those responsibilities now fall on the shoulders of family members. So you would think that there would be a higher level of regard, respect, collaboration with caregivers, but I know that my experience, and I'm sure this resonates with others, was that I was, kind of trying to contribute, trying to offer very important information about some of the symptoms that my dad was having, some of the things that he was experiencing, the concerns that I had. And in my case, it really wasn't until I disclosed that I was a physician that I felt that I started to get the ear of my dad's medical team. And so then I said, well, okay, if it was this difficult for me, what happens for all the other family caregivers who don't happen to, be a physician or a nurse or some other member of the healthcare field? So there definitely are a lot of barriers for family caregivers as it relates to healthcare, whether or not you have insurance or not. I mean, that's like the lowest barrier to entry to access is having insurance. But even when you have insurance, understanding how the insurance works, dealing with the benefits or lack thereof, surprise medical bills, and just, the lack of affordability, high deductibles, finding specialists. I mean, there are people who live in areas where they don't even have access to the specialist that their loved one needs. And then another thing that I dealt with as a caregiver was when you have a family member who has more than one chronic disease, which is most of us, they have all of these different doctors. None of them are talking to each other. And so that just creates even more confusion and complexity.
Yeah, and going back to your point on patient being at the center, totally fair point. You got me there. my attempt was to illustrate I guess the caregiver oftentimes being on the periphery or outside of the
Yeah.
periphery really is probably more accurate. But I find it so interesting to hear your personal share about when you're caring for your father, and invisible is a perfect word. Um, uh, just really resonates with me deeply. Um, but I just find it so interesting that it wasn't until you disclosed that you were a physician that you felt like you started, because I can just imagine it's difficult when um, you're thinking about advocating for your loved one in the medical setting, and it's just hard, right? You're talking to these professionals who've been trained for years and years and years. So it's almost like there's just this subconscious sort of discounting of our own opinion and sort of gut instinct. So just really interesting to me to hear you mention that.
Yeah, and just to quickly piggyback
Yeah,
on that, Matt, you know, 'cause to kind of tie it back in with the health inequities
yeah,
and the bias that you mentioned a few minutes ago, when you pair again that baseline feeling that all family
yeah,
caregivers have experience of being ignored, and then you pair that with, you know, a person of color or someone of lower
yeah,
income and all the biases that healthcare providers, many of them unconsciously have. So they're now faced with a member of this different racial and ethnic group or someone with a different income level, and they carry all of these stereotypes and opinions about whether or not this person is educated, whether or not they understand, you know, medical terms and things like that. And even with the patient, there are decisions that are made by healthcare providers about whether or not someone is likely to follow through with recommendations. So there's studies that show that even when there are clear guidelines that dictate how you manage a particular condition, not everybody gets that same care because of implicit biases, and in some cases, explicit biases as well.
really appreciate your adding that perspective and tying it back um, systemically. And this is another conversation or series of conversations. Um, any thought? I'm just interested in your perspective on how we make progress towards fixing it systemically. Um, really, what I main priority for this conversation today is about ways that caregivers who are facing everything we're talking about can sort of work through these, work around these inequities and additional challenges. But I'm just curious, hearing the way you're sharing your perspective so far. I mean, any sort of macro level thoughts on systemic priorities to make progress towards?
Yeah, you know, systemically, and these are the challenges that healthcare organizations are facing. And a lot of the work that I do as a health equity consultant is because we didn't get here overnight, right? Like,
Mhm.
to your point, these are systemic and structural inequities that have existed in our country for hundreds and hundreds of years. And so undoing those is a process. But just some of the examples really have to do with diversifying the healthcare workforce. And there are a lot of efforts really across the country to do that, recognizing that when you are being cared for by someone who not necessarily looks exactly like you, but shares some of your characteristics, maybe shares your culture, your language, there are countless studies that show that the care that is provided is improved, the rapport, the communication is improved, and even the outcomes are improved. And so it's important, especially as our nation becomes more and more diverse, that the healthcare workforce taking care of the nation looks like our communities.
Mhm.
And so there definitely are some efforts around that, which, you know, started, some of that is like making sure that we are nourishing the pipeline, for lack of a better word, and making sure that there are exposure and there are opportunities for, you know, starting back in really elementary, middle, high school, but certainly college and professional school, nursing, medicine, pharmacy, social work, making sure that there are efforts to recruit a diverse workforce, but also to retain them,
Mhm.
making sure that they are welcomed and that they have the resources that they need. So that's one kind of systemic thing. And also going back to social drivers of health, really making sure that we are addressing the things in the communities that are preventing people from achieving their best health. So, making sure that there are initiatives around economy and like wages, fair wages, and opportunities for advancement, making sure that all communities have access to something simple like fresh fruits and vegetables. I mean, there are still communities in our country that don't have a grocery store at all, that have, stores that don't have fresh fruits and vegetables. And then even if you have a store that has them, can you afford them? I don't know about you, Matt, but I have been like really looking at my grocery bill just go up exponentially, and then being thankful that I have the ability to afford fresh fruits and fresh vegetables and things like that. Green spaces, again, we can blame certain communities for being overweight, for being more likely to have obesity or high blood pressure or diabetes and all these other conditions. But when you look at the fact that many of them are in communities where they don't have green spaces, they don't have parks, it's not safe for the kids and the adults to go outside and walk. So it's like things that, depending on your background, you may take for granted. So there's really like high level structural things that need to occur. And I'm really enthusiastic about some of the innovative partnerships that are starting to happen between hospitals and health systems and community-based organizations, because we're now realizing that, yes, it is our problem, even though we're in healthcare, and people may say, well, that's not my problem about jobs and safe, green spaces. But in fact, because of the ways that impacts the health of the communities that we care for, it is our problem. And so really making sure that those in healthcare are partnering with those in the community and those in the financial sector and all of those other things, so that we can really make sure that everyone is healthier.
I just really appreciate your perspective and the context that you're providing. We have 6 minutes left, and time flies when you're having fun. So I wanted to just segue into some tips or some ideas or strategies or thoughts that we might be able to share for caregivers who are facing these challenges, facing the challenges that we've been talking about right now. And to your point, we didn't get here overnight. I'd imagine it's certainly not going to be, the system's not going to catch up or be fixed overnight. So in the meantime, how can caregivers who are in it right now sort of navigate these additional amplified challenges that we've been talking about? Do you have any thoughts on tips that come to mind?
For sure. And I appreciate that question. And you and I are on the same page with that. Hopefully one day, maybe not in my lifetime, the systems will be fixed. But you're right. Like in the meantime, what are we to do? What are family caregivers to do? And I think in general, specifically as it relates to navigating the healthcare system and as it relates to kind of coming up against some of these barriers that we've talked about, it's so incredibly important to show up in a manner that helps to mitigate some of those biases and really kind of positions you in a way where you can really get what your loved one needs. And so going back to what one of the attendees put about health literacy is incredibly important, and making sure that we as caregivers arm ourselves with the information that we need so that we can appropriately communicate and engage in dialogue with healthcare providers, even when their tendency may be to dismiss. So one of the things that one of our frameworks at Your GPS Doc is a GPS system that I just love using and sharing with other family caregivers in terms of like how to effectively navigate the healthcare system. And it's very practical. So the G is to gather information. And really at the crux of that is asking questions. We know that most family caregivers don't have a medical background, and you shouldn't be expected to have this high level of knowledge, but you are the expert for your family member. And so asking questions rather, and gathering information so that you are clear about the conditions that your family member has, the symptoms associated with those conditions, the treatment plan, understanding the medications that your loved one is taking, and understanding the indications, the reasons that they're taking those medications, maintaining lists of those medications, and really just gathering the information that you need so that you can show up as confidently as possible in healthcare settings. And then that leads to P, which is to position yourself as the expert. So again, we know that you may not have gone to medical school, you may not have gone to nursing school, but you are with that loved one, that spouse, that child, that parent, many, many hours of every day. And so no one can replace that level of expertise. And so being confident in sharing concerns, being respectful, but firm in pushing back when healthcare providers are maybe saying things that either don't sound right, giving recommendations that you already know are not going to work for you or for your loved one, and really using that language and using that information that you gained by asking questions to then position yourself as the expert. And then the S is to speak up, and every family caregiver has done this, but it's so important to be a strong advocate, especially in healthcare settings where you may be the one to pick up that medication error. I mean, that happened to me where my dad was about to be given something that he was very much allergic to and could have really harmed him. And I was the one as the caregiver who looked up and noticed that, he was about to get this medication. And non-physicians, non-nurses, non-healthcare family caregivers do these kinds of things all the time. But a lot of times we second guess ourselves, we second guess our gut, and we sometimes will defer to, that other expert in the room. So speaking up, advocating on behalf of your loved one is incredibly important.
I love that. Gather, position yourself as an expert, and speak up. And all aligns to the notes that I had made to ask you about. So we're definitely on the same page. One other tip I wanted to ask you about that I think could be applied. It relates to a question I see or comment, not a question, in the chat. And we're at time, or almost at time, but we're going to be bold and go 1 minute over, maybe 2, if that's okay. But
okay.
And the tip that the audience member or the perspective the audience member is sharing is about identifying as a caregiver, which to me, based on what you were just talking about, Dr. Rochester, sort of is somewhat of a precursor. And in particular, the audience member is asking about a challenge around identifying as a caregiver, sort of in the context of cultural expectations, right? And identifying. I'm just personally a huge just believer in identifying, and I was a caregiver for my mom for years before I actually identified, and it was certainly a light bulb moment because it plugged me into available potentially available resources and just other caregivers and all of that. But in this context where there are cultural expectations sort of that make it even harder for someone to identify, and what are your thoughts there in terms of a final point?
Yeah, I think it is important that we acknowledge that identity as a caregiver is going to vary based on individuals' cultural identities, and so I think one thing is just to broaden the definition of a caregiver. Like you, Matt, I didn't identify as a caregiver early on, so someone who may live hundreds of miles away but is making sure that the bills get paid or they're ordering groceries, you're a caregiver. It doesn't necessarily mean just the person who's there in the home providing that direct care. And in terms of the expectations, that's a whole nother, maybe we'll have a follow-up conversation around that, because there definitely are some cultural expectations that sometimes lead to a lot of guilt among caregivers, things that about whether or not the person is going to stay in the home, whether or not, we don't do that in our family or we don't do that in our culture, and being faced with those challenges of maybe not being able to meet up to the expectations of what is typically done. So I think that's a whole nother conversation, but it is important to recognize that the definition of a caregiver is going to vary, and the expectations and the needs are going to vary as well.
Oh, I appreciate that. So did I see a commitment from you to join me again at some point in the future? Did I hear that? Is that what I
Yeah,
heard in you?
I'd love to come back.
But I really, really appreciate that. We are 2 minutes over, so we'll wrap up. Any final thoughts? Anything on your mind that you'd like to leave the audience with, Dr. Rochester?
I think the main thing, I want to leave you with hope, because I know that these conversations are often kind of burdensome, and we spend a lot of time talking about the challenges, but just leaving you with hope, and really I always want to send hugs and love to family caregivers, because I've been there. I know how difficult it is, but things are improving, and I think that with your help, honestly, with the family caregivers, we're going to get to where we need to be, for sure.
Oh, I hope you're right, and I can certainly co-sign on the hope. It's one of my favorite words. So thank you so much, Dr. Rochester, for joining us. Thanks to the audience for joining us. Hope if you're able, we'll do this again next April, or next month, April 27th. And the topic is actually related to something Dr. Rochester said, but working with your loved one's insurance 101. So we're going to just spend 30 minutes talking about practical tips to make that part of the caregiving equation a little bit easier. So that'll happen 12 p.m. Eastern, April 27th. Dr. Rochester, thank you so much for joining me. Really, really appreciate it.
Thank you for having me. It was
All right.
wonderful.
Talk to you
Take
soon.
care.
Take care. Thanks, everyone.